New and waiting mothers in England will be capable to accessing assist in psychological public health problems more than readily during the following year, on to NHS England. More than rather than £20 metre will be consumable on services in underserved components of the nation. The ad follows commitments to enhance the assist proposed to mothers by both of the ex-Main Secretary David Mr Cameron and more than newly, Theresa May. The new financing based on £40 metre devoted in 2016. 1 in 5 female will expertise a prenatal psychological public health issue, freely certain as one how occurs each for pregnant or during a year of give or childbirth. The largest overall issue is depressive or concern, but prenatal problems involve a broad band of facility. The NHS advises how if leftward raw, they can include considerable and length-lasting effects on the female and her household, as length-standing effects on families' emotion, public and cognition growth. But as newly as 2014, services were very inhomogeneous in England, in just 3% of the nation convicted to propose nice accessing to thoroughness. In 2016, NHS England announced how £40 metre would be consumable on more than medical staff, psychologists and psychiatrists to ensure assist to mothers and families both of in the household and in motherhood units. Teams can as well involve public workers, professional therapists and kennel medical staff. So far more than rather than 7,000 female are believed to include available expert assist via new or advanced services. Public health facility bosses say the produce of a future £23 metre should indicate how by April following year, pregnant women, female and new mums through the entire of England are capable to accessing expert thoroughness and supporting. Claire Murdoch, Domestic Psychological Public Health CEO for NHS England, says how psychological ill public health doesn't distinguish. It can occur to nobody, at any period, and it disrupts lifetime, not fair for mums but the entire household. That is why we are completely devoted to drive Stryker improved in thoroughness and enabling the essential region of psychological public health continues to get the focus it deserves, which we are now start to see is testimony-based NHS services increasing in components of the nation wherever down they're utilized to be bounded, or no regulation at all. Professor Wendy Burnup, CEO of the King's School of Psychiatrists, as well welcomed the new financing. We are impressed to include been capable to job close in NHS England and Public Health Formation England to assist supply the lot needed prenatal psych labour of the next, she told. How 100% of the psychiatrists who finished our prenatal scholarship schema now include, or will include, prenatal advisor psych jobs in their regional areas is fabulous. Along in the new wavelength of AIM financing, will assist provide how new and waiting mums will be capable accessing expert prenatal society services in each portion of England by April 2019. Justine Roberts, founding member of Mumsnet, told the new financing could do a big distinction to lot female. Mumsnet's campaigning for superior puerperal thoroughness has allocated the width of prenatal psychological public health vulnerabilities, and has shown how lot female fight on in symptoms how do them sense pathetic, or worst. Additional regulation in the key region is so essential and we expect it makes a actual distinction in support pregnant women, female and new mothers.